So all the glycolytic enzymes, that is glycogen synthase, hexokinase, glucokinase, all will be inhibited. Now we are again we will try to concentrate here in this gluconeogenesis pathway. Here one point is very much highly mentioned here. In the last line we can say that high concentration of alanine, it acts as a gluconeogenic signal by inhibiting the glycolysis at the pyruvate kinase stage. So we can see here this is a pyruvate kinase. So the pyruvate at the pyruvate kinase stage, the alanine is inhibiting the pyruvate kinase and preventing the formation of pyruvate. Instead, pyruvate has to be converted to, in the opposite direction, phosphoenol pyruvate. So alanine is playing a very important role here. Okay, so how it is possible, that we will see in the next slide. So in the fasting state, we can see there is a considerable output of alanine from the skeletal muscle. It is formed by the transamination of the pyruvate produced by the glycolysis of the muscle glycogen. So muscle glycogen, by the process of it is converted to pyruvate, then pyruvate is undergoing transamination to form the alanine. Now this alanine is exported to the liver. In the liver, where another transamination process happens, and it will be reconverted to pyruvate. And this pyruvate is the substrate of gluconeogenesis. Okay, so this can show us that glucose alanine cycle, it provides an indirect way of muscle glycogen to maintain blood glucose level in the fasting state. Okay, so in this way muscle glycogen is also taking part in the to increase the to maintain the glucose level in the fasting state. Now I will tell you to focus to another line in this graph, in this gluconeogenetic graph, that is the ATP required for gluconeogenesis is supplied by the oxidation of the fatty acid. So now this gluconeogenesis pathway is favored by alanine. It is also favored by the energy that is generated by the fatty acid oxidation process. So fatty acid oxidation process is a very important process to maintain the blood glucose level. Okay, now increased fatty acid oxidation, it is characteristic of starvation, as we all know, and as well as in diabetes mellitus. And what we want to say that as a result of this beta oxidation, by beta oxidation the body is trying to maintain the glucose, but the byproduct of it will be ketone body. So there this ketone body or the ketosis will ultimately give some bad result, that we will see. So what happens from the adipose tissue, the triacyl glycerol, with the help of the enzyme lipolysis, the process lipolysis, so it will be converted to free fatty acid. As the free fatty acid will enter into the blood, and from the blood it will enter into the liver. As the concentration of free fatty acid it increases with the onset of starvation, so these free fatty acid will be converted to acyl CoA. Okay, so how it is converted, that we will see, because the free fatty acid can have two types of fat. Okay, one type of fat is that in the fat state it will be esterified to acyl glycerols, and when we are having starvation it will not enter into this esterification pathway, it will enter into the beta oxidation pathway. The end product will be the ketone bodies. Okay, so how it is happening, before oxidation, we must say that before beta oxidation the fatty acids are activated to an active intermediate in presence of ATP and coenzyme A. We can see in the first figure, with the help of ATP and coenzyme A, the enzyme acyl CoA synthase, which is also known as the thiokinase, catalyzes the conversion of fatty acid or free fatty acid two and more active fatty acid, that is the acyl CoA. Okay, so there is an enzyme that is carnitine palmitoyl transferase 1, CPT1. It is located in the outer mitochondrial membrane. It converts the long chain acyl CoA to acyl carnitine. We can see that this CPT1 is converting it to acyl carnitine. These acyl carnitines, easily it will penetrate the inner membrane and will enter into the mitochondria, will gain access to the beta oxidation enzyme. So this is the first step. Okay, so from the fatty acid to the activated fatty acyl CoA, then it will enter into the mitochondria. Now inside the mitochondria, we can see that there is this CPT is located in the mitochondria. CPT1 is also located on the mitochondrial membrane. Okay, its activity is increased in the starvation. Now normally what happens when the insulin level is high, okay, so acetyl CoA from the glucose, it will form the malonyl CoA, and it is a process of lipogenesis. Lipid will be formed and lipid will be stored. Okay, so when the lipid formation is there, when we are feeding, we have adequate food, this malonyl CoA will actually inhibit this CPT1 or the carnitine palmitoyl transferase 1. But in case of starvation, the acetyl CoA carboxylase enzyme, it will be as the free fatty acid concentration increases with starvation, acetyl CoA carboxylase is directly inhibited by this acyl CoA. This acyl CoA is directly inhibiting the acetyl CoA carboxylase. So the malonyl CoA is not forming, and its inhibitory effect on CPT1, it is withdrawn. So it allows more acyl CoA to be oxidized, and these events are reinforced in starvation by a decrease in insulin and increase in glucagon, that is decreased insulin glucagon ratio. Now when this acyl CoA, it is ultimately inside the mitochondria, so enzymes responsible for the ketone body formation are associated within the mitochondria. So we can say that the two acetyl CoA molecules formed in the beta oxidation, they will condense with one another to form the acetoacetyl CoA. We can see here, this is the acetoacetyl CoA is formed here. Now condensation of acetoacetyl CoA by the enzyme, that is 3-hydroxy 3-methyl glutaryl CoA synthase, that is also known as HMG CoA synthase, it will form the HMG CoA. It will form the HMG CoA. So HMG CoA is the another name of HMG CoA is the 3-hydroxy 3-methyl glutaryl CoA. Now this HMG CoA will further will be converted by the enzyme HMG CoA lyase to the acetoacetate, and from the acetoacetate there will be formation of 3-hydroxybutyrate. Okay, so these three substrates, acetone, acetoacetate and 3-hydroxybutyrate are known as the, collectively they are known as the ketone bodies. So when there is increased ketone bodies in our bodies, it happens during starvation. So there will be hyperketonemia or the ketonuria. So ketones will appear in the urine, and the overall condition is known as the ketosis. The basic form of ketosis, it occurs in the starvation. So acetoacetic and 3-hydroxybutyric acids are both moderately strong acids and are buffered when present in blood or other tissues. So however, their continual excretion in quantity progressively depletes the alkali reserve, resulting in ketoacidosis. Okay, so this condition will be further enhanced by the presence of uncontrolled diabetes patient. But ketoacidosis is very fatal. It may cause the ketotic coma, and it may cause death of the person. So this is a reference, Harper's Illustrated Biochemistry 28th edition. Thank you for listening.